AskReddit. Doctors of Reddit, what's your thank god they came in for a second opinion moment? Like and subscribe if you enjoy the video. 22-year guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did examined he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit. He lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year woman. Fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of brain cancer she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward, patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. Okay, eye docs are my best friends. I had massive sinus pressure and pain for about 2 years. Had been seeing an allergy specialist because the allergy specialist, GP, and I all thought the pain was because I am allergic to life, which I am, which didn't help anything. Then one day my right eye just stops adjusting from bright to dark and vice versa. Then during the adjustment time I would get extremely nauseous. My future hubby then points out we get one eye exam per year covered by out insurance, and I haven't had my eyes checked in over 5 years. So we book an appointment. He squeezed me in later that week. I was still seeing at 20/15 vision, but my field of vision tests show I was about 70% blind in my right eye and 50% blind in my left. It's really amazing how the brain just compensates. I never noticed. He dilated my eyes and my optic nerves were swollen so large that the machine couldn't register it, and I broke an office record. I get told to head to the hospital ASAP. He gave us all the documentation we needed. Get to the hospital, and the moment the ER doc heard pulsating tinnitus and looked at my eye doc records, I got the world's quickest spinal tap. My opening pressure was over 60, normal is like 15 to 18, depending on needle and method, and I shot spinal fluid across the room. Magically, my vision pretty much returned, my sinus pressure was gone, and I was no longer at risk of a brain hemorrhage. So, ophthalmologists have a very special place in my heart. He literally saved my life. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. Similar story to myself. When I was a young teenager, my mom taught a nursing class at a local tech school. She wanted me to volunteer for EKG practice, so I did. She hooked me up and ran the tests, and they were rejected inconclusive, showed nothing, I'm not sure. Something that's abnormal. So she said it happened sometimes and she just had the students practice on each other. As soon as we left, she drove me to the hospital and got a cardiologist to check me out. Turned out to be nothing really. The tissue that makes up my heart is a particularly bad conductor compared to most, so it took too long to travel and timed out, rejecting the returning information. Doctor said I'm in the 1% for slowest electrical movement in my heart, so EKGs won't work properly on me. I like to joke that dial-up was the standard in the 90s, so don't make fun of the hyping. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36-48 hour history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and AMP, WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and ARCI was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high. Not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature, as it often causes similar features. Comparing a higher level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, that is pulmonary edema, hypoxia, ARCI etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Edit, some words. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back, I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after, this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. My girlfriend was diagnosed with MS in 2010 when she was 23. Before she was diagnosed, we thought it was just a combo of the flu and an inner ear issue. She couldn't eat without puking, super weak, etc. We finally took her to the hospital after this issue didn't get better after a few days. They just gave her some basic medicines and sent her on her way. Issue was persistent, so we started looking for something more. We finally got sent to a neurologist and they diagnosed her. They put her on a daily injection medication, but it still wasn't doing anything for her. She couldn't sit up on her own, couldn't eat, no chances of walking. We took her to the hospital on Thanksgiving Day and one of the nurses was asking her questions to which my girlfriend replied with slurred speech. The nurse had the gall to ask her if she was drunk or on drugs, even though her chart said she had been diagnosed with MS. I crawled all over the nurse's ass to the point that the doctor came in to see what the issue is. After I told him what was going on, he took the nurse out in the hall and crawled her ass and sent her home. We got a referral to another neurologist that specializes in MS. His mother had it and he made it the focus of his studies. He has patients that come from a couple states over to see him. He admitted her into the hospital for a week on a steroid drip and put her on a new medication. Within a week of the steroid treatment she was already walking with a walker. A week later it was a cane. The next week she was walking mostly unassisted. Thank God for her current neuro, he's amazing. You have been visited by Professor Papa. You will ace all your classes this year only if you comment. Study hard, Papa. Also don't forget to like and subscribe for more Reddit related videos.